So we're going to start off with just introductions, and then we're going to have some questions and answers that we're going to kind of go back and forth as a team of presenters. So I'm Kevin Jameson. I'm Assistant Superintendent for Human Resources at Princeton City School District. And for the last 27 years, I've been a school administrator, predominantly at the central office level, and for about 10 years as a building principal. But I've worked primarily at the central office level as a student services or special education director, but currently in my role, I'm a human resources director.
Hi, my name is Dion Thrower. I'm a speech and language pathologist, actually at Princeton City Schools. I've been a speech language pathologist. This is my 17th year of practice. I've worked for Princeton. This is my 14th year. So I've worked with students from pre-K all the way up through transition in that space. I'm also a doctoral student at UC, and I'm working in a doctorate in educational studies with a focus in family and community engagement.
And I am Marita Wade. I am a former director of a child care center, as well as now I'm the current director of development and community relations at Abilities First Foundation in Middletown, which is the Disability Children's Support Services Agency. I'm the only outside.
So we wanted to share with you, there's some handouts that you have in front of you. The first one is just the continuum of educational placements. So we're going to talk a little bit about that as we answer the questions today in our panel conversation. The other document that you have is from the Disability Rights Resources of Ohio, and it's a comprehensive list of different agencies that are out there. After the session's done, we also have some additional handouts that you can grab, which really describe the child's involvement in the IEP process. And the title of that document is from actually the Association or the Council for Exceptional Children, and it talks about why is this cake on fire. So it talks a lot about how to engage young people in the process of their IEP. There's some information about universal design for learning, and also the roadmap that people have to follow when they have to suspect a disability and then ultimately end up in the evaluation and IEP identification. So what we want to do is talk about the objectives for today. So today, our specific objectives are to learn about the resources for neurodivergent students. And so when we think about neurodivergent students, we're talking about any disability that impacts the mind or impacts the brain. So we're talking about various levels of cognitive ability, including those students who may be very exceptional in their cognitive ability. But we're also thinking about specific disabilities such as attention deficit hyperactivity disorder, as well as autism, and in addition to that, aspects of disabilities that affect the mind. And so you think about depression, anxiety, or trauma. So that's the neurodivergency, and that's sort of the umbrella term. The other objective that we want to address is knowing where to go to advocate for the support that's needed for your neurodivergent student. Again, thinking about your child on the autism spectrum, thinking about your child who's suffering from just debilitating anxiety, or thinking about your child who may have a significant cognitive delay. The other objective that we want to address also is the belief that every student deserves an educational environment where they feel safe and supported and that they're thriving in. So this will get into that aspect of like least restrictive environment and what particular type of learning environment is best going to help that child thrive and make the progress as their same age peers. So we're going to start off by hearing from you a little bit about where have you advocated for a neurodivergent child? Where have you been able to find support for them? And so I'd like to hear some answers in terms of different agencies or programs that are in your community or here in Cincinnati that you've reached out to when you're thinking about how to support your individual student. Any agencies that come to mind?
We got a central clinic.
Central Clinic.
The Child and Family Place, and
So Central Clinic is one of our, like in Cincinnati, one of our community-based mental health agencies, and they have a lot of partnerships with different school districts. So sometimes for our neurodivergent kids who might have an anxiety disorder or some other type of behavioral health disorder, then they may get support from not only community action agency, but it may be embedded within the school. What about other agencies?
I'm here with my mother and my daughter. Me and my daughter are both on the spectrum. We are with autismandnew.org.
Oh.
We help students, families with IEPs, 501, so we sit in on all of that, making sure that they understand their rights, understand their faith, and everything else. Just came here to get some more information and to make sure people know about us and we know about them. So
Excellent.
having a great partnership with the community.
Great. So I'll give you my card and like to learn a little bit more about that. All right. Great. Thank you. So we have some questions. We've got a bit of a script that we're working with each other as far as a panel conversation. Normally there's a moderator that's asking us questions, and I've been in that format, but this is a different format, which I think is really good and will get some good conversation going. So, Dr. Mariette. Good, how are you? Good. So there are so many different resources. This is one of the challenges in supporting neurodivergent students. While we might know of a place or a program for certain needs, we may not have the knowledge or access needed to support a particular child. And if you are a parent or an educator and you know that kids are so different, that makes a good resource for one child might be totally different for another student. So can you talk a little bit about the continuum of what's your experience has been in working with children at the early stage in life?
So one of the advantages of the agency that I work for, we actually have an inclusive child care center. So we actually take care of all children regardless of ability, from birth to age 10. But then we also have an autism learning center that serves pre-K to 2nd grade. And in our center, we actually have pediatric therapy, so that's speech language pathology, that's physical therapy, that's occupational therapy. So what I have learned working in this world, working within the dynamics of my agency, every county, and I'm in Butler County, but it's Butler County Children First Council, Family and Children's First Council. That is a whole hub of networks that come together for the betterment of all the children in the county. So Hamilton County should have one, every county, Claremont, Butler, whatever county you're in, you should have one of those agencies, one of those coalitions that bring together a numerous amount of resources, knowing what questions to ask, knowing, just being bold in your approach, because I mean, what I found is that so many of the parents that come to Abilities First, they're at their wits' end. You know, they're like, I know my baby needs help, but I just don't know where to find it. I don't know the questions to ask. And unfortunately, even if you are college educated, if you don't know the language to speak, if you don't know the questions to ask, you will be on this hamster wheel trying to get to the resources that you need to get to. So what we have at Abilities First is a no wrong door policy. So we get referrals from, because we serve 4 or 5 different counties. But unfortunately, we're up in the northern part of, Cincinnati. So, but we do have clients in Hamilton County. But what we do is, whoever is referred to us, whoever calls us, we have a success liaison. And that person is a point person that walks with the family, regardless if you're able to use services at Abilities First or not. We're going to try to find the right door for you to go into to get your child the services that they need. So that's what we do at my agency. And we have a lot of people that come in and don't know anything. So hopefully that we're able to connect them with what they need. And even if they're not, we're gonna find a way to make it happen, because that's the population that we work with. So when you have someone that comes into the agency or comes into the airport, anywhere asking, hey, I I need help. One of the hardest things is to get the proper diagnosis. We've had families that have come to us and they haven't gotten the right diagnosis, so it's the diagnosis that actually opens the door to the resources that you need. So in my experience, and especially dealing with my own niece, even in Indiana, we were all sitting in that room. It was like 9 people at a table. And it was like, well, my niece, she leaned over to her mom and she said, why are we even here? Because they're not listening. Mm-hmm. And my sister, she's very educated. But had I not been there and used my title to throw my weight around, I wouldn't have been able to get my niece the resources and the services that she needed. So that's just kind of been my experience. It's been.
Yeah. So again, kind of really thinking about when you first learn that your child has a disability, of course, that may be before they even enter the school system. So really being knowledgeable about the services and supports and what rights you have at age 2, 3, 4, before they even hit preschool or kindergarten is really important. So one of the things that we're required to do, every school district is required to do under the Code of Federal Regulations and also under Ohio Revised Code and also the operating standards for supporting students with disabilities, we have to be able to identify sometimes our students who have neurodivergency across 13 different disability categories. So there's a handout that you can reference after the session that will talk about those 13 disability categories, and a lot of them include ones such as intellectual disability, autism, emotional disturbance, there's a 13 deaf, blindness. All of those categories are identified by the operating standards. And so considering that wide range of disabilities and neurodivergency, every school district should offer a continuum of educational placements. And so this handout right here describes when that child is first identified as a student with a disability through the evaluation process, that IEP team has to look first and foremost at the least restrictive environment, which is that child's neighborhood school learning with their typical peers. But when you look at the disability and the types of services and supports and specially designed instruction that's needed for that student, that could take the child further and further away from what you see here at the top of this continuum down to the bottom of the continuum. And so again, looking at that least restrictive environment, I would say a large proponent of our students who have more high incidence disabilities such as specific learning disability and speech and language disability are going to be included within their typical environment with their typical peers. But sometimes, depending on the intensity, frequency, and duration of some of the behaviors and concerns associated with the need, then you may step further and further away from that. And so this diagram really kind of delineates that. And if a school district doesn't offer something on this continuum in-house, then sometimes they have to contract outside. So when you're thinking of a larger district that has 30,000 plus students, like a Cincinnati Public, when I was student services director there, we could offer a lot of what was in here, but we still had to contract out for some specific services for students. But if you're a small district, say you've only got 1,000 students in the district, the economy of scale sometimes doesn't allow for you to offer everything that's within here. So sometimes you have to get creative and contract out and build that continuum from what you offer in-house and what you offer outside. So we wanted to make sure that was sort of the landscape that we talked about. But sometimes there are barriers to receiving the support that a student needs. And so, Dion, can you talk a little bit about the barriers that you've seen from your angle as a related services personnel, because we have students who have receptive and expressive language needs. What have been some of the barriers that you've seen, especially in the secondary environment?
So in general, I'm a speech language pathologist, so I'm considered a related service. So when you think about related services, you think about speech pathology. The most common are like speech, occupational therapy, and then physical therapy. There are some other ones where you might have support for hearing services, just of various different things, but you usually hear about speech, OT, and PT. So as far as the barriers, I think that there's just some misunderstandings about the support that people need. And when you think about speech language pathology, I think people often are like, well, that person doesn't need speech because they talk fine and I can understand them and that's okay. But for my scope of practice, we deal with anyone with any kind of communication disorders. So we can have some very high incidents when you think about articulation, some things that are kind of mild when you think about receptive and expressive language, and then there's some more high incidents where you have, or low incidents, I'm sorry, where you have students who really need just support in basic communication, whether that's using a device, picture symbols, or things like that. As far as Dr. Jameson said, the secondary level, I get a lot of pushback for keeping a kid on speech because it's like, well, they don't need it, they're fine. But when you think about some of the high stakes testing that we have, just being able to understand and follow directions. I work at Princeton High School as my primary placement. So I also work with a lot of students that are transitioning. They're leaving from high school, going to post-secondary. And so there's a lot of that being out in the community, thinking about, so this person speaks fine, but do they know how to sit in an interview? Do they know how to communicate their wants and needs? Do they know how, after they finish a task at their job, to go talk to their boss? Or just understanding direction. So I do a lot of that kind of support. So the barriers, I think, is just kind of a lack of understanding from the point of view, especially of educators who don't really understand what some of these related services are needed for. Mm-hmm. So.
And I was also going to talk, we talked before today about the, sometimes you find that funding can sometimes drive access to services. So I would spend a lot of time with parents sometimes who maybe were middle class, upper middle class, or maybe they just did not access Medicaid, which is a form of public assistance. And they're looking to try to integrate whatever mental health support that child needed within the school setting, because that's a really good way to practice skills and learn about those skills and then apply them in school all under one umbrella. So a lot of families would say, well, no, I mean, my health insurance through my employer is not going to cover a therapist through XYZ agency that wants to partner with the school. So yes, through what you've observed at the school, there's this need. What do I observe at home? Yes, there's a need. But how do I access that, and who helps me navigate that mental health care continuum for individuals who may not always qualify for Ohio Medicaid? And so, like in our district, one of the things that we've been able to do is we've been able to utilize like the governor's student success and wellness funding that was issued out to all the school districts. Or in addition to that, we have Title III dollars that helps for like our students who are English learners. Every once in a while, we look at additional funding streams that aren't necessarily driven by a child's eligibility based on their family status, but based on the count of students that we have in the district that have a particular need. And it's just thinking creatively about, okay, yes, that child cannot access services through National Youth Advocate Program, but this child is an English learner, and we have Title III dollars that can help support that. So why don't we contract with National Youth Advocate? And they can come in and provide that service to our kids who qualify for Title III support. Yes, but at the same time, we also may have students in that same setting who do have Ohio Medicaid, and they can also access the therapist through National Youth Advocate Program. So it's really thinking creatively around those barriers at the district level to try to see what we can do continually to provide those type of supports. So the next topic that we wanted to discuss is kind of explaining how some children are late bloomers, and you're not really seeing kind of those needs until they get to be about 4 or 5 years old. There's no official diagnosis, right? So there's not a warm handoff during that early stage. So Mariette, can you talk a little bit about kind of how do you transition then what agencies and services and supports that you're familiar with to the school system so that there is a bit of a warm handoff there?
Well, that was my Achilles heel when
Yes.
I was sorry.
Yeah.
One of the things that frustrated me to no end is that, we could tell that, in early childhood, you have certain milestones that you're supposed to reach by a certain age. And if you don't reach those things, that you kind of behind at 18 months, kind of start looking like, okay, what do we need to do next? Not every child develops at the same rate, so that doesn't mean that the alarms should start going off, per se, but you do need to start to monitor some things. So from the preschool setting, from like about 3 years old, I had some kids in my center, and I was like, there's something just not quite clicking. And one of the hardest things in a director role is to sit to sit across from a parent and say, look, these are the things that we are seeing that are going on, but we need to monitor these things. And we also need to probably start looking, trying to get you an eval at Children's Hospital or get you in somewhere. And the first thing that the parent does, oh no, ain't nothing wrong with my baby. And it's like, we're not saying anything is wrong with your baby, but we are seeing some areas of opportunity that you may need some extra supports in. So everything is not an attack. It's a partnership between the parent and, the child care provider or even the school system. So the earlier that you can try to get those intervention services in place, the earlier that you can get some type of, and not even a diagnosis, but because, when we look at, what goes on in IEP, it's not just a learning disability. It's, if you have anxiety, my niece had a traumatic brain injury. Those things are on those letters for you to be able to obtain extra services. So when we're going through and we're looking at different things, funding generally doesn't open up until they're, 4 or 5 years old. That's really frustrating, and that's something that's been at the state level, that's been thrown around for a long time. Like, we need more support at the primary ages, because if we don't lay that foundation, then by the time they get to kindergarten, first or second grade, they're already behind, they're already falling through the cracks, and while you may slap a behavioral thing on a child, a behavioral label on a child, that may not be what's going on. It's something else that needs additional services and supports around. And I probably have gotten off track. Make
okay.
sure I'm going the right direction.
Okay.
This right here takes me to another.
Yeah.
Well, because one of the things that we do with the agency that I'm working with now is that we do have those relationships within the school district. But generally, school districts, they don't want to talk to individual child care providers. We've had these babies from 6 weeks to 5 years old. We know them better than their parents do. So we do have those partnerships with the different intervention specialists at at the elementary school level, because that's our handoff, and we're able to facilitate those conversations. And we're able to provide the documentation, because we're fortunate enough that we have 2 intervention specialists on site that actually work with our children from the time that they get their IEP in place until the time we hand them off into a school system. I know that it's not ideal everywhere for that to happen. But that's one of the things that we've been able to do to ensure the continued success of our students. The Autism Learning Center, the children there, they attend based on the Autism Learning Scholarship. And in that scholarship, not only are they paying for educational services, but they are also paying for that PT, OT, speech, and behavioral therapies. Unfortunately, because of the pandemic, it exposed so many different areas of weakness in our education system that we have these backlogs. So a lot of, I on my list of resources that I provided, there's 3 to 6 month wait lists for children to get these basic evaluation services. So the thing that I encourage parents to do, don't give up. Because if you do not keep going back, the squeaky
wheel gets the wheel, yeah.
So be the squeaky wheel. Be that person to keep going back and going back. And if you don't get answers, take some more people with you. Because otherwise you're going to continue on that hamster wheel, as I said earlier, and not get the help that you need.
And so it doesn't, oh, yes.
I'm sorry, I just have a question. What if you have this help set up? Like, I have a fourth grader now. She has a caseworker, she has a therapist, she's on medicine, she does have an IEP, but the school's not gonna have a caseworker come to her school and meet with her. They are not letting her come to the school and taking the child out to meet with the child.
That's not legal. It's a violation. That's not legal at all.
Yeah.
Yeah,
I go to South Avondale. When she
Oh, that's
was
our school. Please be careful.
Yeah.
Yeah, we have a doctor in South Avondale.
Yeah.
And, yeah, we have a doctor in South Avondale in Rockdale, and if that's going on,
like that.
Yeah.
So it was like,
Yeah. Yeah.
Days of the time to be
hear
here.
that, and we have to go into IEP meetings and tell people, honey, you have to understand that. That's not-
Yeah, yeah.
Parents
I
don't
was
know
not
that.
able to get the IEP process started for my son until he went to withdrawal. And we even at CPS since he's in third grade. So I've been fighting, I've been coming with legal aid, I've been coming with other people, because with Dr. Autism, we just got evaluated in the central clinic, she's ADHD and anxiety. But I'm like, okay, now that we're in this process, now we need to get the other stuff
In place.
situated.
Right.
That's why I'm like, okay, I couldn't get the right school
Right.
because we went to Avondale, but we should still get the same kind of benefits just because we're in
Right.
a certain district.
Right.
So yeah, like they didn't do anything the whole pandemic because it happened in third grade. Then now he's getting the help at withdrawal. So they have 504 plans, but it was just a sentence, according to what your withdrawal psychologist is saying. So now we got to go back to South Africa, make sure my daughter has it, so that I can advocate for other parents in the community as well.
Right.
This is the whole problem with the teacher not showing up and everything else. And we've been trying to work with that school and give the parents the support they need. So please let us know.
Yeah.
I have so much to say.
Yeah.
It's a huge issue.
Yeah.
Yeah.
So one of the things that I think, it's good, like we have conversations like this because we were able to make connections to help solve problems, but the problem doesn't, or the issue doesn't go away simply because you're transitioning from preschool age to school age. Because we all know that students sometimes transition. They leave one district and go to another, or they leave one town and come to another. So when you think about an incoming student, they could be a first grader or a 10th grader or a 5th grader. And it's your first opportunity to really look at that IEP, look at the evaluation, or if those documents are not in place, then it's important for school systems to have what's called a multi-tiered system of supports. And so part of that multi-tiered system of supports includes interventions around the academic components of what's going on with that child. So the reading and the mathematics, but then there's also the behavioral. There's also some of the other components that are really supposed to create a plan around the student that doesn't necessarily have to lead to that child being on an IEP if the team can intervene early enough, meet on a frequent basis, monitor the progress, and then get to a point where you're like, yes, they've been able to respond to that intervention or set of interventions, and now they can successfully transition with their typical peers unidentified, without a label. But then also that same process allows you to go through this evaluation roadmap, which we'll talk about in a minute here as it pertains to like a speech and language example, because I know at the early childhood level, like at the elementary level, you talk to your colleagues at the elementary level and it tends to come up more frequently there, even though it's not impossible for it to come up at the secondary level. But when a common issue that I see sometimes is at kindergarten, when kids come in and they're not pronouncing their words right, then certain team members or even family members will say, I think they need speech and language services right away. So can you talk a little bit about the intervention process that sometimes SLPs get pulled into to help explore that?
So everyone does not need speech therapy, but that's just my blanket statement. But I think one of the things, especially when you think about COVID, so if you think about someone coming in at this point at 5 years old, just what were they exposed to when they were born and things like that. The thing about the evaluation process in the multi-tier system is that everyone does not need to be identified as a student with a disability. However, there are some students who may need more support than a typical child, than your typical child. So when you think about identifying someone, because no, you don't want to just slap a label on every child that comes in the door, because you have to take so many things into consideration. Has the child ever been to preschool? Has the child ever had to sit in the classroom? Is the child used to taking 2 naps a day? Then you go to a full day kindergarten. That is big things for very little people. Does the child have a bad R sound? Guess what? The last developing sound is R, and it can happen by the time you're 9 years old. So I am not going to see a kindergartner who has a bad R sound. I'm sorry. So I think it's just that realization of trusting your team, but I understand sometimes why you cannot. But trying to trust the professionals and going in with an open mind and saying, these are my concerns, instead of jumping in and saying, this needs to happen right now. Because at the end of the day, you don't necessarily always want to slap a child with a label. You want to see how do they do in the classroom. What's already in support for the, what is a natural support that is in the classroom. So if you say, my kid can't sit without an adult by him, say, hey, we already have people, we have extra people in the class because it is kindergarten and it's October and none of them can sit.
Right.
And you also have to notice, like, is this child doing anything atypical from all the other kids in the classroom? So if I have a class of, let's be honest, 30 kindergartners wherever no one can sit down and it's October, as a teacher I'd be like, give me till December and let's see.
Yeah.
If, you know, so it's a timing thing. And there are some students who, when they come in, and some of the natural things that are already put in place by a teacher or a support person in the classroom, or a speech language pathologist, OT, PT, anyone that's already in the building, they do have those supports. They do consult those people, and they do have some red flags. So I think the biggest thing that I could say for anyone who has a child where they think there is something atypical is to communicate.
Right.
But communicate in an open way where you're not coming in and like pointing fingers and saying you have to do this, but say, hey, like, this is what's going on, this is what I noticed, this is what he's used to. And I think a lot of times providing some of the history of, you know, what goes on at home, what he did in preschool, maybe he was just at a daycare where they never had to sit and do circle time and look at letters. So it's going to be a lot harder for my kid than her kid who went to a very structured preschool who's like, oh, this is just the next step. So I think a lot of that also with behavior. So I think the biggest thing that I can say to anyone is that you have to communicate with your team, but I think you also have to be educated on what your rights are as a parent. But also, it is not a problem to just go in and say, like, what is your intervention support look like in this building?
And a lot of that,
Ask this question.
a lot of that is tied to a concept of, has anyone heard of universal design for learning? Okay, so we're talking about, I always think of the acronym EAR, which is multiple means of engagement, the why students need to get connected with the content, the multiple means of action and expression, which is how they're going to show that they actually know the content, and then the multiple means of representation, meaning like what are the ways that they're going to show that they know the content and how it's being communicated to them, needs to really be differentiated when you think about especially this part of the continuum and the neurodiversity of like your classroom. And so the important part of that process is really being able to then looking at the start of your planning process for lessons and activities with students in the classroom. How are you thinking across the breadth of students that you have who are neurotypical, but this is their least restrictive environment? So again, it's the goals, the methods, the materials, and the assessments around that lesson and how you're using those multiple means of action and expression, engagement, and representation so that students can show what they know in different ways.